This is chapter 15, and we are talking about community pharmacy. And our learning objectives are the following. At the completion of study, the students will be able to have a basic understanding of pharmacy practice in the community setting, be familiar with the setup of a community pharmacy, understand basic customer service principles, understand the basic prescription processing in a community pharmacy, understand the general duties of a pharmacy technician in a community practice setting. Okay, so let's turn to page 15 and let's look at thinking it through, and we will come back to those particular questions at the end. So, thinking it through is the following. It says the following. As you read this chapter, consider what you would do in the following situation. 1. A customer is dissatisfied with having to wait for the prescription. 2. An elderly customer tells you that because of her arthritis, she has a hard time opening her medication bottles. She also tells you in conversation that it was difficult for her to get to the pharmacy because she doesn't drive. And 3, a customer is asking what she can purchase over the counter to treat her cold and cough symptoms. All right, so let's be mindful as we read and as we go through this particular session of those particular 3 points and come back to them at the end. So, certain things that I talked about within this particular chapter is community pharmacy, regulations, organization, customer service, processing the prescription, preparing the prescription, customer pickup using a cash register, other duties, and then we are going to review thinking it through. So when we look at a community pharmacy, again, I mentioned the learning objectives. At the completion of the study, students will have a basic understanding of pharmacy practice in a community setting, be familiar with the setup of a community pharmacy, understand the basic customer service principles, understand the basic prescription processing and community pharmacy, understand the general duties of a pharmacy technician in the community pharmacy setting. And as you read this chapter, consider what you would do in the following situation. A customer is dissatisfied with having to wait for their prescription. An elderly customer tells you because of her arthritis, she has a hard time opening her medicine bottle. She also tells you in conversation that it was difficult for her to get to the pharmacy because she doesn't drive. And a customer is asking for what can be purchased over the counter to treat her cough and cold symptoms. There's 2 particular videos that I want you to take a look at. They're great links, and they give you an overall view of how community pharmacy are put together. Okay, when we're talking about community pharmacy, we are talking about community retail practice. It's a practice of providing prescription service to the public. Almost 2/3 of all prescription drugs in the United States are dispensed by community pharmacy. And when we talk about community pharmacy, we're talking about, CVS, and we'll go into a little bit more details about that. One of the key characteristics of community pharmacy is close interaction with the patient. Strong interpersonal skills and good customer service are essential in a community pharmacy environment. Another thing that you should recognize, well, again, the practice of providing prescription service to the public. 2/3 of all prescriptions drugs in the United States are dispensed by community pharmacies. And one of the key characteristics of community pharmacies is a close relationship interaction with patients. So you have different types of community pharmacies. You have the independent pharmacy that's individually owned, usually maybe 1, 2, 3, 4, 5 stores and no more. You have a food store pharmacy such as A&P, Giant Eagle, Kroger's, Pathmark, etc. You have the chain pharmacies like CVS, Walgreens, Rite Aid, and there's others. Those are the big three. We have the mass merchandisers pharmacies that you find at Walmart, Kmart, Costco, Target. All right, so those are the different types of community pharmacies that you should be familiar with. Because of the rapidly growing aspects of community pharmacy, one of the things that you should note is that there are different types of services that are provided from those particular pharmacies. You have what's called disease state management. Disease state management programs provide one-to-one pharmacist patient consultation sessions to help manage chronic diseases and conditions such as diabetes. I've also added something like hypertension, asthma, those diseases that are chronic and can last for a lifetime. It has something called MTM, which is medication therapy management. And these services are similar to DSM, but it's tailored to the provision of the Medicaid Part D. Remember when we were talking about medication Part D, this is talking about the reimbursement that is done by the government for prescriptions. So MTM has 5 key elements that you should be familiar with. One, it is the medication therapy review. Well, 4 key elements. The medication therapy review, making sure that the medication that is appropriate. The personal medication record, or have the person taken in the past, or what they're presently taking, so there's no having 2 drugs that may not work with each other. Medication relation action plan, what will be done, what the patient will do from this point on, beginning the process of taking the medication, and then the intervention or referral and documentation follow up. And when we talk about intervention, is ensuring that the patient is complying with the medication action plan, or if there's any type of referral that's necessary to the care provider of the patient. And of course, all of these are associated with documentation. And then, of course, a follow-up of the patient to see how they are doing. Okay, so those are some things that are very, very important as it relates to MTM. Now, basically, what we're talking about here is the actions taken in order for care to be given. Some of the things that you may find is that pharmacies may also have walk-in clinics, such as what's called minute clinics that you find at some CVS, or take care clinics that you find at Walgreens. And these come under consideration of what's called clinical services and programs. And pharmacy technicians help with these services by coordinating billing with the patient's insurer, company, scheduling appointments, and taking patients' information. And so these are all things that are important. So again, disease state management of DSM, one-on-one pharmacist, patient consultation, and it provides many things such as general medication advice and information, diabetes education monitoring, asthma, which is a chronic lung disease, chronic obstructive pulmonary disease, which is usually associated with long-term smokers, education and monitors, anticoagulation education and monitoring, The anticoagulants that we're talking about in terms of warfarin and coumarin are very important. Blood thinners for some individuals who have a predisposition to clotting, weight loss programs, decreasing obesity, having individuals to stop smoking, and then cholesterol reduction programs. A lot of times include diet and exercise. So this is disease state management. MTM, again, is tailored to the provision of Part D. Again, we talked about Part D as it relates to pharmacy. And so, prescription drugs. So 5 core elements. The Medication Therapy Review, or MTR, looking at the personal medical records, or PMR, medication action plan for the patient, which we touched upon, MAP, and if there's any intervention that's necessary for patients to increase compliance, or if there's any referrals that are necessary. And of course, all of these particular steps need to be documented, and also a follow-up. How are the patients doing, especially as it relates to the medication-related action plan. Okay, so let's look at some of the clinical services and programs. Walk-in clinics are staffed with nurse practitioners, and usually they just do very minor injuries and calls. A community clinic that you may find at CVS. And then many of these community clinics or things that you find at a pharmacy, they have vaccination program for influenza that causes flu, herpes zoster, causing chicken pox, and sometimes can reoccur as shingles. There's a vaccine for that. Pneumococcal infection that causes pneumonia. There's a vaccine for that, usually needed for older individuals. Right. How technicians help with pharmacy technician services and programs. Pharmacy technicians help with these services by coordinating billing with the patient's insurance company, scheduling appointments, and taking patient information. So again, coordination of billing, scheduling appointments, and taking patient information are some of the key components of the pharmacy technician as it relates to pharmacy clinical services and program. Okay, let's go ahead and take a look at some of the federal regulations. And again, we all talked about these in the past, but they're very important to review and in essence regulates CVS, not CVS, pharmacies in general. So here we're talking about the regulation of the federal regulation affecting the community pharmacy. So you have OBRA. OBRA is 1990s, and OBRA stands for Omnibus Budget and Reconciliation Act. Requires community pharmacists to offer Medicaid patients counseling and instruction regarding prescription drug doses, route of administration, and duration of administration, special directions, common side severe side effects or interactions, and therapeutic country interdictions, proper storage, and also what to do if the dose is missed, and refill information. Okay. We're gonna start this session at this particular point in time, and go back and continue on with the talk of regulations as it relates to the community pharmacy from a federal standpoint.